The Sinai Medical Foundation Oral History Project is being conducted by the Leonard and Simons Jewish Community Archives. My name is Michael Burke, and today's date is October 17th, 2023. I am interviewing Dr. Eli Brown. Dr. Brown, do you give permission to the Leonard M. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for use as deemed appropriate by the archives?
I do.
Good. So let's start at the beginning. Where and when were you born?
Baltimore, Maryland, April 25th, 1923.
Let me do the math. What inspired you to become a doctor?
Well, mostly my family.
Mm-hmm.
My brother was a doctor, my older brother was a doctor. My two brother-in-laws were doctors. My sister was a bacteriologist, and my other sister was a nurse, so we were sort of
The family
medically
business.
oriented.
Yeah, the family business.
Yes, the family.
So let's just talk for a moment. What was it like growing up in Baltimore? I'm just curious.
It was strange growing up in Baltimore. Baltimore was a segregated community at that time, and there were different neighborhoods. There were Jewish neighborhoods. There were neighborhoods that were restricted. Jews could not buy houses there. So that it was a sort of thing. I used to have to travel by streetcar a long ways to get to my school, which was in downtown East Baltimore. We lived in Northwest Baltimore, and I used to have to travel for more than an hour
Really?
on the streetcars to get down to East Baltimore, where I started my school.
Was it like a day school, a parochial school, or was it just
It was, it is what is now the Talmudical Academy of Baltimore. At that time, it was known as the Hebrew Parochial School.
So tell me a little bit about the dynamic. Was it a good Jewish community in Baltimore?
Oh yeah,
Yeah.
very strong Jewish community. Very strong Jewish community. Northwest Baltimore particularly was many synagogues in the area, mostly Orthodox synagogues at that time.
Mm-hmm.
There were very few conservative or Reform synagogues in the area.
Mm-hmm. Were you involved in the community at all? You know, as a volunteer?
As a kid, I really didn't do too much except go to school.
Uh-huh.
Other than that, I didn't.
Okay. Where and when did you go to medical school?
University of Maryland. I went to undergraduate school at University of Maryland, and I went to medical school at the University of Maryland.
Mm-hmm.
I got my BS degree from College Park, which is undergraduate school, and then I was accepted to medical school at the University of Maryland.
Good school?
It was a very good school. It suffered by being in the same city as Johns Hopkins, but it was still a very good medical school. It was difficult for Jewish kids to get into medical school at that time.
I want to talk about that. Why don't you share with us, the difficulty that a Jewish student faced in trying to get into a quality medical school?
Well, there was a quota, 10%, no more than 10% Jewish. as a result of that, what happened was that Jewish students with straight A averages were not able to get into medical school, whereas Christian kids with as little as C averages could get into medical school. It was a very difficult time.
So let me ask you a question. Once you got into the school, you obviously were part of that 10% that got into the school. Was there any difficulty with the non-Jewish students while you were going to school?
Not really. There, as usual, some of the students there were anti-Semitic, openly anti-Semitic, and we knew who they were. But for the most part, I think the students got along very well with each other.
Did you maintain a relationship? Oh, I'm sorry.
There were only 4 girls in our class, 4 women, as opposed to today there's over 50% women in medical school, and no students of color.
Yeah, times have changed.
As I said, Baltimore was a segregated community, and the schools were segregated.
Did you maintain relationships with any of the students after you graduated from medical school?
Oh yes, I maintained quite a few relationships with the medical students. One of the students, Joe Minzer, actually roomed at my home in Baltimore, and we roomed together there. He had no place else to room, so we roomed together at my home, and we maintained a relationship afterward, and many other, but it was pretty well segregated in the school too. For example, we couldn't get into any of the Christian fraternities, and so we had a Jewish fraternity of our own called Phi Delta Epsilon, where essentially all of the Jewish students got together. So we were pretty well segregated in medical school. And even though we had some Christian friends, of course, in the school, but for the most part, we were sort of apart.
So I'm sure you graduated with high honors. And,
I don't know if I should say I did. I actually did very well. I did very well. But it's interesting now that the top 6 students in the class were Jewish.
Yeah.
Out of 10.
What does that say?
Yeah.
So you graduated with in that top 10, obviously.
Right.
And then you went on to residency, or you went on?
I went on. You had to have a rotating internship in those days. It wasn't so easy to get rotating internships. Most of the Jewish kids went to Jewish-sponsored hospitals.
Were there many in Baltimore?
There's only one in Baltimore. It started out to be known as the Hebrew Hospital, but then they changed the name to Sinai Hospital, and that was situated across the street from Johns Hopkins Hospital. So some of the Jewish students went there. 3 of us went up to the Jewish Hospital of Brooklyn in New York. I was interested in going to New York, so we went to the Jewish Hospital of Brooklyn.
Good school, good hospital?
Very good hospital. They had some famous people there. They had Rudolf Nissen, who was an internationally known chest surgeon.
Mm-hmm.
They had a pathologist who did a lot of the work on the Rh factor, blood typing of that sort. They had Leo Lowy, who was did some of the early work with heart surgery, and other very famous people were at Jewish Hospital. Had a very good reputation.
And a good experience for you? It sounds like it.
It's an excellent experience.
So, Eli, when did the Korean War come into play in this
Well,
this dynamic?
No, the Korean War wasn't until later. What happened was that I was inducted into the Army in 1943 or 44, at the end of 43, and I was assigned to the ASTP, which is the Army Specialized Training Corps. And while I was in medical school, I was serving as a private in the Army. After I graduated, I was discharged from the Army, but I was kept in the reserves,
Mm-hmm.
with the understanding that I would be called back after I had my internship. I finished my internship, and they allowed me to have 1 year of residency in anesthesiology
Where did you do that?
at Jewish Hospital of Brooklyn.
Okay, so you said, yeah.
And it was after my 1 year of residency, and that would have been 1948,
Mm-hmm.
I was called back into the Army.
As a private?
No, as a first lieutenant. And I was first sent to Valley Forge General Hospital in Pennsylvania, which was a very large hospital, and worked on people who were wounded in the war.
Mm-hmm.
You know, rebuilt their faces. Plastic surgery hospital.
Orthopedics too?
Yes, there was some orthopedics there also, but mostly it was plastic
Plastic
surgery. And as a result of that, I worked with people from the University of Pennsylvania, and I got credit for a second-year training in anesthesiology, and they allowed me to take my written boards
Mm-hmm.
in anesthesiology. In order to be certified, you had to take written boards, and then you took oral boards
Mm-hmm.
and practical examination. Well, I was allowed to take my written boards as after being given credit for the time at the University of Pennsylvania, having been at Valley Forge. And after that, I was sent to Japan. And I was part of the Army of Occupation.
Huh?
That would have been in 1949. While I was in Japan is when the Korean War broke out. And I was at a station hospital in Osaka, Japan.
Mm-hmm.
And we usually ran a census of less than 100 patients, cold, sore throats, broken hips or something. Within 2 weeks after the war started, they shipped most of our doctors over to Korea, and I was the only trained anesthesiologist in southern Japan, and there was only one surgeon at our hospital, one trained surgeon at our hospital. within those 2 weeks or so, we had close to 1,000 patients
For the two of you?
for the two of us.
Wow.
It was a very difficult time. We worked around the clock, 7 days a week, and with just 4 hours sleep a night, not much more than that. And that lasted for about 4 weeks until we got some replacements from the States. So that was my experience in the Korean War.
Did you have a good nursing staff? I said, did you have a good nursing staff? Did they help? Were they?
Well, I'll tell you what we did. We got the oral surgeons and dentists into the operating room. I would start an anesthetic, turn it over to a corpsman. The oral surgeons and dentists would open the wound. The trained surgeon would do the definitive work, and then they would close the wound. And we went round and round. We had 3 operating rooms, and that's the way we worked.
Wow.
And that went on for about 4 weeks before we got replacements.
Uh-huh.
It was a difficult time.
I'm sure
It was a difficult time.
And no shortage of patients, unfortunately.
Unfortunately, you know, that's when the North Koreans came down, and there were lots of American casualties, because our division from Osaka was the first division to go into Korea, and they fought a battle, you know, with retreating all the time until they got to the postage stamp at the bottom of Korea.
Mm-hmm.
And so there were lots of casualties.
Yeah. Thank God for you and your associate. Otherwise, there would have been a lot more casualties, I'm afraid.
Yeah, I'm sure.
So you know, I don't want to make light of the war, but I want to kind of move on to, you know, Sinai Hospital and the reason that we're here primarily. How did you get from Korea, Baltimore, to Sinai Hospital here in Detroit?
Well, after I was returned to the States, I was sent to the States. I was reassigned. I was supposed to get out of the Army, but they
didn't want to let you go.
extended it, and I was assigned to Camp Pickett in Virginia. And I served there for another year until things were stable in Korea. And after that, I attained the commissioner's major. That was my highest commission. And I was discharged in 1951.
Mm-hmm.
And I went back to serve as an attending physician at the Jewish Hospital of Brooklyn, where I had trained.
Right.
And I was there for until 1954. In 1954, I attended a national meeting of the Phi Delta Epsilon fraternity. We had people from all over the country who were members of Phi Delta Epsilon, and in that year it happened to be in Baltimore, so I came down from New York and attended the convention. And there was an obstetrician from Detroit. His name was Emil Rothman. He cornered me and said, "We need an anesthesiologist in Detroit for a new Jewish hospital." Well, I wasn't entirely happy in New York because We lived out on Long Island. I had to travel long distances, and I didn't think it was a very good place to raise a family, and I had 3 kids at that time.
Mm.
And I said to my wife, who's a native New Yorker and wasn't happy with the idea, I said, well, let's go out and take a look at it. The only thing I knew about Detroit was Henry Ford and Father Coughlin.
Yeah.
And that wasn't very
Good role model. Good role models.
Yeah, that wasn't very inviting. But I said, you know, I've never been to Detroit. They're going to pay our expenses. Let's go out and take a look at it. I never dreamed that I would really move to Detroit. But when I got out here, the people at the hospital that I met were so hospitable, you know. I can't name the number of people. They were very hospitable. And I said to Estelle, we're gonna move out here. I liked everything that I saw, and we just decided to move out. I like to say I dragged her kicking and screaming across the Hudson River. But it was the best move I ever made. It was the best move I ever made, because I would never have attained the academic or the organizational positions that I had in New York.
And I bet eventually she became content with the decision to your wife.
With the what? Oh, yes. After she was here for a while, she loved it. She loved it. Yeah.
So you came, I think you came to the hospital in its 2nd year of existence?
Yeah, the hospital was built in 1953. I came there in 1954.
So kind of describe the dynamic of the hospital at its embryonic stages as, you know.
Well, it was a nice small hospital, and it was I think it was it served the neighborhood very well. It served the Jewish community very well. But it wasn't really academically oriented at that time. They had a lot of good practitioners. The chief of surgery, Dr. Salstein, was a very well-known physician. Dr. Saul Myers in medicine was very well known. Dr. Sugar, an ophthalmologist, was very well known in the city. But essentially they had not built up any academic practices anywhere.
So it sounds like their original intent was just patient care before they...
It was mostly patient care. That's exactly right. It was a nice community hospital. That's the best way to describe it.
Yeah.
It was a hospital. And they recruited some young people. I was in my early 30s. Dr. Kobernik, who was head of pathology, was in his early 30s. Dr. Mellons, who was radiologist, was in his early 30s. And Dr. Honnett in physical medicine was in his early 30s. We were all just starting our careers. We hadn't made any reputation or anything at the time. Dr. Salstein, of course, was well known. He was chief of surgery. But then they also they started to recruit full-time physicians. And that's when things changed. They recruited Dr. Jack Burke from University of Pennsylvania. They recruited Dr. Sherman from Washington University in St. Louis. For OBGYN, they recruited Dr. Rosenzweig from the University of Michigan for psychiatry, and then it became a more academic institution. We all started to develop residency programs, and we started to get affiliation with the university. I started out as a assistant professor at Wayne State University, and I rose to become professor and finally chairman of the department at Wayne State University. And also as professor emeritus, I have a little plaque there on the wall.
So
It tells you the years that I served there.
So it was a good marriage.
And that's why I said I would never have attained that
Right.
if I had stayed in New York. And that's how the Sinai Hospital started to develop. We developed a teaching program. Wayne State started to send students to Sinai Hospital, and we developed as a very good academic institution.
It sounds like it was
I might say that we reached our peak. We were probably the best academic institution in the city of Detroit.
it sounds like it was a very good marriage between Wayne State and the hospital.
Yes, it was very good.
And there was, I hear the crossover that you worked at the hospital, but were also
Yes,
the
I
academics
worked,
at
I
Wayne
worked at
State.
Sinai, but I also became chairman of the Department of Anesthesiology at Wayne State University. So that was quite a feat.
I'm curious, Sinai Hospital was started because of the need to find a place for Jewish doctors to be able to practice. But I'm curious, the atmosphere in Detroit, number one, what were there possibilities at other hospitals for Jewish doctors? And were there possibilities for non-Jewish doctors at Sinai Hospital?
Okay. The opportunities for Jewish doctors at other hospitals was limited. There were some on the staff at Mount Carmel Hospital and some on the staff at Northwest Grace Hospital. But most of the doctors worked at the North End Clinic, which was a free clinic for Jewish patients mostly, but other patients, of course, attended there too. But there wasn't much opportunity for any kind of advancement in any of those hospitals. And so, like so many other cities, they felt the need to have a Jewish hospital where you could have Jewish physicians work and have opportunities for advancement. That was the idea of building Jewish hospital, not only there, but in other cities as well.
Yeah.
It was the sort of same thing. There was very limited opportunities for Jewish physicians.
So I'm curious, Dr. Brown, did most of the Jewish doctors come from local Michigan universities, or did you get Jewish doctors who came from other parts of the country to come and practice?
The heads of the department, we were all from different parts of the country. I was I came actually here from New York. Sidney Kobernick, chief of pathology, came from Montreal, Canada. I don't know, many other parts of the country. Al Sherman came from St. Louis. So there were lots of people recruited from other parts of the country. Most of the practitioners in the hospital, though, were from Detroit.
Mhm.
They had been practicing in Detroit.
And they came from what, the University of Michigan and Wayne State's medical schools? Is that where?
Well, some were associated with, but not a whole lot.
Mhm.
Most of them were just practitioners in town,
Ah,
and they had very limited opportunities.
and but there were non-Jewish doctors at the hospital too, correct?
Oh yes, we had a number of non-Jewish hospitals. As a matter of fact, Dr. Homer Smathers ran the surgical training program. He was associated with the university. He and his brother were surgeons and practiced at the hospital, and he ran the surgical training program. My own cardiologist was non-Jewish, and he worked at Sinai. Yeah, there were many Christian people who worked at the hospital, and as a matter of fact, there were interns and residents who were non-Jewish who were welcome at the hospital.
Mhm.
There was one thing that was a little difficult at the beginning. When I first came to Sinai, there were no black doctors there. None.
Mhm.
And I remember at one of the meetings, there was discussion. They had an applicant for an internship who was going. And there was objection from mostly the obstetricians because they felt that there would be some difficulty with their patients, particularly in obstetrics and OBGYN.
Mhm.
And so there was a big discussion about whether they should have a black intern. Well, I had come from a segregated place, and then I went to New York, where of course it was non-segregated. And I felt very strongly that we should have an opening for black people, because I had suffered the anti-Semitism that occurred, in medical school. So, and there were a number of other doctors there who felt exactly the same as I did. And so, it's interesting, we did take this black intern, and the funny part of it, 2 years later, they accepted him as a resident in OBGYN.
Isn't it? That's a wonderful story.
Yes, it is.
It's a wonderful story. And then I would assume
After that.
that was the barrier breaker. And then
After that, there was no problem at all.
Tell me about
There
this.
were many black students and Asian doctors that came to the hospital.
Tell me about the census of the patient body. Mostly Jews, or general community, or?
Mostly Jews, but also others, yes.
Did the Jewish patients feel that they wanted to be at a Jewish hospital because they felt more comfortable there, in your opinion, or they felt that the quality of care was better? Or
in the beginning, their doctors were Jewish. Most of their doctors were Jewish, and so they felt comfortable. Some people were interested in having kosher meals. That was an important thing to them, particularly the Orthodox community. So I felt that was probably two reasons that they wanted to come to Sinai Hospital. So most of them were the Jewish community.
Mm-hmm.
And at that time there was great support from the Jewish community.
Yeah.
People like Max Osnes, who was the first
Sure, I remember
president of the Board of Trustees, Abe Strury, I remember, Davidson, who ran the federal department stores, and people of that sort were very active at Sinai. Nate Shapiro from Cunningham's, all those people, Max Fisher, of course, Maxwell Josby, all those people were very supportive of the hospital at that time.
Were there any non-Jews that were supportive? Any non-Jews that were supportive of the hospital?
I don't know. I don't think there were very many.
Sinai became known as a preeminent teaching hospital.
Absolutely, absolutely. After we got our full-time chiefs in there and we developed our training programs, I would say that Sinai Hospital, you see, before Sinai Hospital was sort of junior brother to places like Harper and Henry Ford, but I can tell you, when we reached our peak, you know, and that would have been in the 60s or 70s, you know, we were the most academically oriented hospital in Detroit.
It was, I've been told it was a very innovative hospital too. That there were lots of programs that evolved out of Sinai Hospital. And
yes.
so
yes.
Talk a little bit about the kinds of things that were established
Well,
at
first
Sinai.
place, we had good research done at the hospital. We had a chief of research, Pierre Foa, who was head of research there, and he stimulated a lot of publications that came out so that all of us developed in our own specialties. We all became involved academically, associated with the university. There were many publications that came out of Sinai Hospital, and there was a lot of good work. One of his buddies there, Hugh Beckman, did a lot of research work in ophthalmology. There were a lot of people who did a lot of good original work, and Sinai became known as a highly academic institution and a great place to have a residency or other training program.
How did the culture at Sinai change over the years, in your opinion, as it grew and became more well known and more preeminent in not just this community, but in the world of hospitals, particularly in the United States?
Well, I think the way Sinai came to be known is by the individuals. We all advanced in our organizations nationally. For example, I became president of the American Society of Anesthesiologists, and I also served as a delegate to the World Federation of Anesthesiologists and to the Joint Commission on Accreditation of Hospitals. And other chiefs did the same sort of thing. And so that's the way, through our staff, that Sinai became known throughout the country. It was through the way our staff advanced organizationally.
Were patients sent from other parts of the country to be treated at Sinai?
Yes. Mainly in heart surgery. That was later on.
Mm-hmm.
And people from Canada came to Sinai to have heart surgery.
What was your favorite parts of working at the hospital? I'm sure there were.
Camaraderie.
Uh-huh.
Everybody tell you that. It was a camaraderie. Well, not only were we colleagues, we were friends. I can recall that we had a small little lunchroom near the operating suite. And we used to congregate there for coffee and donuts and lunch and things. And we were just friends. And we were not only friends at the hospital, but socially outside the hospital. Mm-hmm. So it was the camaraderie and the desire to get ahead, you know, working with each other to advance the goals of the hospital. Those were the things that really made Sinai a wonderful place to work.
It would seem to me as a layperson that just having that resource right at your fingertips, if you needed help with something, you had all these doctors in the hospital
Exactly.
that you could turn to.
Exactly. And we worked together very well. Yeah, it was a wonderful place to work.
Anything you didn't like about working there?
Well, the one thing I didn't like about it was when I first got here, I was on call 24 hours a day, 7 days a week, because I had no other anesthesiologists here. All I had were nurse anesthetists. Gradually, as I developed the residency program, I took on other anesthesiologists, mm-hmm. and that made it a lot easier. And we developed a very good program. So that was one thing I didn't like about it. I can't think of there may have been some political infighting that was not very pleasant, but not very much of it. I think that if you ask any physician who worked at Sinai and had to leave after it closed to go to other hospitals, they felt more comfortable at Sinai than at any other places that they worked. And I did too.
I'm going to talk about that in a moment, but just a question came up from the last question I asked you. What was it like being at the hospital during the time of the riots in '67?
That was a difficult time. Because first place there was fear. You know, a lot of people were very afraid of how far it would spread, and also there was difficulty in many of our workers getting to the hospital. Uh-huh. They lived in those neighborhoods, and so that was a difficult time, and there was a lot of fear of what might happen. So that was probably the very beginnings of the downfall.
Yeah, I would assume there was a change, a little bit gradual perhaps, in the census of the population of patients.
Exactly,
that's coming into
was starting to happen. What happened was after 1967, they built Beaumont Hospital, and because the neighborhood where Sinai was located began to change, you know, mm-hmm. slowly over the next 10 years or so, a lot of the Jewish community started to go to Beaumont. And then hospitals became more willing to accept Jewish physicians. And so a lot of our physicians got privileges at Beaumont Hospital. There was consideration at the time, I have to tell you, about Sinai moving out to the suburbs.
Mm-hmm.
And I recall, I happened to be chief of the medical staff at that time. And I recall that Mr. Lowenstein, Mickey Lowenstein, had just made a contribution to the hospital to enlarge the OB suite.
Mm-hmm.
And I remember at a board of trustees, I attended, as chief of staff, of medical staff, I attended some of the board of trustees meetings. And I recall that he suggested that Sinai move out to Maple and Drake across from the Jewish Center.
Right.
I was all for it. I thought that would be a great opportunity for Sinai. But unfortunately, some of the Board of Trustees felt that we owed an obligation to Detroit to remain in the city. And so they decided against moving out. I think that was a big mistake, because I think Sinai would still be in existence if we had moved out there at the time. And that was a big loss.
So how did you feel when you learned that the hospital was going to be sold?
I felt very bad. Not only me, every physician there. They tried mightily to keep it open.
What was it? The economics just didn't work anymore? Is that?
Well, what happened was that the Jewish community had moved further out. The neighborhood changed at Sinai so that the Jewish people were less likely to be willing to go to Sinai Hospital. And they started to going to Beaumont. And then some of the Board of Trustees became affiliated more with Beaumont than they were with Sinai. And we lost some support from the Board of Trustees. And, you know, as I said to you before, the physicians never knew how great Sinai was until it closed. Yeah. I felt the same way.
By the way, I don't editorialize in these comments, but I agree with you. I think the hospital should have moved to the north.
Absolutely.
And it would still be here.
It would still be in existence.
But the good thing that occurred with the sale of the hospital was the Sinai Hospital Foundation. So tell me how you got involved with that and the impact that it's had on the community over the years.
Well, I really can't take credit for anything about the Sinai Foundation. I of course attended many of their earlier meetings, but by the time that came to be, I had already retired from Sinai. So my son would be able to tell you a lot more about
he's
that.
On the list somewhere.
In 1992, I stepped down as chairman at Sinai, though I retained my position at Wayne State University. And I went down and worked at the University of Miami. I had been there as a visiting professor, and the chief of anesthesia at the University of Miami said, "You've retired from Sinai, why don't you come down here and work?" And I said, "Well, I've got my family in Detroit." So I said, "But I'm willing to come down for 6 months of the year," obviously the winter months. And to my surprise, he said, "Fine," because they needed somebody to help with their teaching program down there. he had 108 residents in his program, and he needed help. And I had been chairman of the residency review committee, so he wanted my expertise there. So while I was still chairman at Wayne State University, I spent the winter months at the University of Miami. So that's how I got to Miami.
And it was a win-win for Miami and Detroit because you're here and you're there.
Yeah, I did both.
That's a win. Who were some of the people that, you've named a number of people, but from a medical perspective, who were some of the people that were influential in your career and your career advancement not, you know, particularly in the Detroit area?
Well, people, of course, my old chief of anesthesiology from New York helped me get started organizationally, and Paul Dumke, who was chief of anesthesia at Henry Ford Hospital, also helped me get involved organizationally, you know, in the American Society of Anesthesiologists. So those are a couple of people from Detroit. And then, of course, I had many good friends at Sinai. Dr. Sorak, Dr. Jerry Hauser, and, you know, there were other people who were very good to me. I must say, my wife was very instrumental in both my advancement academically, because she was had a master's degree in English, and I never submitted a paper for publication until she went over the English.
That's great.
And she also helped me as I advanced to become president of the American Society of Women. She was very helpful in those things.
That was one of my questions I was going to
Yeah,
ask.
and she traveled with me all over the world. You know, when I was invited to speak in different countries around the world, she always went with me.
A real partner, huh?
Yeah, very close partner.
So we talked about your wife. Just a word or two for the record about your kids and grandkids, great-grandkids?
Great-grandkids, yeah. Well, again, my sister used to say, you know, when people talked about how great it was to have a doctor, she used to say, we got him a dime a dozen. My two sons, of course, are physicians. My grandson, I'll start from the beginning.
Go for it.
My sister's son is a cardiac surgeon. He was head at Ohio State, head of cardiac surgery at Ohio State University. My brother's two sons were physicians. Okay, now let's see, my children, my daughter's children, my grandson is at the University of Pennsylvania Children's Hospital called CHOP, which is a very well-known pediatric institution. His sister is at the University of Illinois. She's head of the training program in dermatology. So my brother's two sons were physicians. We have them a dime a dozen.
A real family business, huh?
Yes.
How would you like Sinai Hospital to be remembered?
Well, I would like it to be remembered as one of the finest academic teaching hospitals in Detroit, with some of the finest physicians in Detroit. And the Jewish community should be remembered, and I think they should be given a lot of credit for erecting Sinai Hospital
And their continuing support.
and continuing support of Sinai Hospital. I certainly do.
And the foundation is really kind of an extension. They continue even though the
Yes,
hospital
it
doesn't
is.
exist.
I'm very happy that the ones who followed me there established this foundation, because it's good to remember Sinai. I think we did some very good things for the community.
Dr. Brown, it's been a great pleasure. Is there anything that we missed that you'd like to say in closing?
I don't think so. I think you covered it very well.
This has been, for me, a personal treat. So thank you very much for your participation.
Quite well.
This will be a very valuable addition to the community record.
Well, it's been a pleasure for me to do it.